Thank you for joining us today. I am so overjoyed to be introducing two of my close friends. We've met through the Armenian professional healthcare organizations. This is a network of providers throughout the world. We frequently meet by Skype, by Zoom, in person at conventions, and we are now networking with them to assist us in helping residents for the Armenian Home. It really gives me great pleasure to introduce the president of the Armenian American Nursing Society, which is based in California, but represents nurses everywhere, Taguhi Sargsyan. She is wonderful, she's dedicated, and really representing the best of the nursing profession. Thank you so much for joining us. It also gives me great pleasure to introduce a colleague, Dr. Matt Nalbandian. I know Matt through the medical circles where he has an outstanding reputation as a surgeon. He also is with us today in a different capacity. He has volunteered his time to assist as Vice President on the board of the Armenian Nursing and Rehab Center in Emerson, New Jersey. Thank you so much to both of you for being here, and thank you for helping us reach out to help the Armenian Home through this difficult time.
The New York metropolitan area has been very hard hit with the coronavirus and the stress that it's been putting on our healthcare facilities, not only hospitals, but clearly nursing and long-term facility care as well. And the Emerson Home is certainly suffering from many of the same issues that our hospitals are facing. Fortunately, our issues are not related in large part to coronavirus patients. So the vast majority of the patients in the Armenian Home are actually at their baseline health levels. We have at this moment 4 patients that are positive out of 35 inpatients. So the number of coronavirus patients is relatively low compared to certainly other healthcare facilities. Our issue revolves around the staff that are taking care of these patients. So as Larry mentioned, we are very much like other healthcare facilities in the sense that our nursing staff who provides care for these patients is getting overworked. And in addition to that, some of them have been sick themselves, so they have been staying home. They have been quarantining themselves at home to avoid giving any of the patients in the home any illness. Obviously, they're the most vulnerable given their age and their medical comorbidities. We also have other nurses that typically would be working part-time. They have other full-time jobs as nurses elsewhere, and many of them are being overworked by the facilities where they work full-time, so they're not able to come in and provide the part-time care that they normally would be giving the Armenian Home. So between some nurses being sick, some nurses, and when I say nurses, it encompasses everything, you know, CNAs, LPNs, you know, registered nurses. So I'm using that term, but it's all inclusive. We have all of the above working at the home. So between other job commitments, being ill, a significant percentage of our nurses are not available. And so the ones that are working and caring for the patients, as you might imagine, are being overworked and are getting tired. And so we are seeking individuals with nursing backgrounds that can come and help and basically fill in where needed to offset some of the workload for our nurses that are there full time. Prior to this interview, I just got off the phone with our administrator, and you know, he gave me a rundown of what's going on with the different departments in terms of dietary and nutrition, activity, rehab, housekeeping, maintenance. All of the other departments really have been able to work through this. There are some that are sick, that are staying home, but by and large, those departments are all functioning as they normally would. So really nursing which is providing the most intensive care in the home, is what's needed. And so Larry and the Armenian Health Professionals Organization has been really stepping up and trying to help us get the word out to really nurses all throughout the tri-state area, and clearly with this interview on a more national level across the country, to try and get nurses anywhere that are willing to come help. This is something that every facility in the New York metropolitan area is dealing with, and we're all sort of looking for the same workforce. And so we're trying to appeal to Armenian nurses out there, if they have the ability to come and work in the home during this time period, it really would be greatly appreciated.
Thank you for inviting me. It's a pleasure to be here. The Armenian American Nurses Association will definitely, try everything. We're try to network as much as we can between all the organizations here in Los Angeles. We have such a large population of Armenians living here with different organizations, so we can reach out to them. We can use our own networks. We'll send an email to more than 500 members that we have, and also speak to the Armenian Medical Society to see if they can also, because they also have members that are nurses. Are you considering using nursing students, or is that just not allowed?
Well, so I think nursing students would certainly work under certain circumstances. As you know, only licensed nurses, registered nurses can distribute medication and things like that. But clearly, there are nurses' aid type functions, cleaning patients, feeding patients, bathing them. Quite honestly, not something that even a registered nurse has to do, but certainly necessary to work in homes like this. So I think it's probably feasible to have nursing students help. I know in New Jersey, and Larry and I have discussed this, the governor has lifted restrictions in terms of allowing nurses from out of state to come work in New Jersey. So even if you don't have a New Jersey license as a nurse, they are lifting those restrictions. I have not heard anything through any of the hospitals where I work that nursing students are sort of graduating early, if you will. They are doing this with medical students and allowing medical students to go and work at the hospitals where they're going to be training as residents. Maybe Larry can chime in, but I have not heard that same call for nursing students. Do you know, Larry, if that's happening?
New York State has put an all points bulletin out for anyone in the healthcare area. So whether you're a physician, nurse, or other certified health professional, New York State, as well as New Jersey, need your assistance. So in New York State alone, they've had over 85,000 volunteers. These are people not only from out of state, but healthcare providers that have been retired. They've also accelerated, as you pointed out, the graduation of medical students so they can function as physicians. Some schools have kept their medical students in the background to stay healthy, to provide relief when that need arises. I think the other interesting thing about the Armenian Home is this is the Armenian Home that represents both New York and New Jersey. So this is a very, very special institution that's near and dear to all of us. So if we do know any type of a healthcare provider, specifically in the nursing areas at all different levels, that can assist us, this would be a wonderful opportunity to help our community and help the most vulnerable amongst us, and that's the older population. I think, though, Matt, as a member of the Board of Trustees, you should be very proud that coronavirus really has not directly impacted the residents. It's all the indirect impact on the support staff that helps all the older people that are there.
Yeah, we're very fortunate, Larry, and you and I have talked about this in other interviews. The staff at the Armenian Home are very dedicated. They've been there a long time. Many of the staff members have been working there for over 15, 20 years. our Director of Nursing, Mari Kamsikian, is really working tirelessly along with the other nursing staff members to take care of these patients. It's a labor of love for all of them, and we're very fortunate. We're also very fortunate to have a board of trustees that has been very engaged throughout this entire process. We all come from different backgrounds: pharmacy, dentistry, legal, engineering, IT, food service industry, pharmacy. So we represent a lot of different areas, and everybody is trying to utilize their area of expertise to help where they can. And then lastly, our home is really also blessed to have the FA ladies, the Friends of the Armenian Home, many of whom are our spouses or other members of the community that help. They've been instrumental in, the regular sort of volunteering at the home, prior to the coronavirus. Obviously, with the coronavirus, we're not allowing visitors to come in. We have to limit those things, but certainly this is something that all Armenians should really be proud of. You mentioned also, this is the New York Metropolitan Home, and I'll take this opportunity to let everybody know that we are actually in an affiliation and merging with the former New York Armenian Home, which closed its doors a couple of years ago. We've taken in some of their patients, and we are actually in the process of merging our two organizations while we build a new facility. We're building a new inpatient facility right on the Emerson campus, where we have roughly 3 acres. This is going to be a new state-of-the-art facility. We've partnered with Hackensack Meridian Healthcare, which is the largest, one of the largest healthcare systems in New Jersey, and they're helping us with construction and then ultimately with managing the facility. So we're very excited for that, and obviously this is a home for all of the New York metropolitan area.
Very exciting developments, and we will get over this. It's going to take time. This is a marathon, not a sprint. But I think the most important thing that we can all do, whether you're in healthcare or not, is to call friends, and it's typically a friend of a friend of a friend who might be able to help us. There's multiple ways to reach us. If you know somebody that can help us, you can reach us through info@AAHPO.org. If you can't reach us through there, you can reach us through Voice of Armenians. And Dr. Nalbandian, is there another number that you would like them to call or contact you through email?
Yeah, so they can certainly email our nursing director. Her name is Mari Kamsikian. Her email is kamsikian@armenianhealthcare.com. She can certainly field those requests. And then I will also give out our administrator's email. His name is Stephen Epstein. He has been fantastic during this entire coronavirus pandemic. His email is Epstein, EPSTEIN.S@armenianhealthcare.com. And again, those are the two leadership positions that people can reach out to if they want to volunteer. I say volunteer, these are actually paid positions. I want to clarify, we're not asking anybody to come work for free. These would be paid positions that the home is offering on a temporary basis.
Great. I'd also like to take this opportunity to reach out to anyone in the public that's having any issues. At AAHPO, we have received a number of calls from people who are running out of medical supplies, prescriptions, cannot locate their physicians, or are experiencing emotional issues related to this crisis. So we would ask you to email us again at info@aaahpo.org. In addition, we're putting a call out for anyone who's had the coronavirus and has gotten through the illness to consider donating their blood. You can contact us or through the Red Cross. your blood has some very special proteins called antibodies, which might actually help save somebody's life. So please consider this option. We're all going to get through this. It's going to take time. Again, this is a marathon, not a sprint. I want to really thank the entire board and the entire staff at the Armenian Nursing and Rehab Center for all their work in helping the most vulnerable and beloved treasure we have, and that's our older citizens. I'd also like to thank the president of the Armenian American Nursing Association, Nurse Sargsyan, who's graciously joined us today and has joined our effort to recruit some terrific Armenian nursing staff.
Fill those spots until this pandemic is slowly coming to an end.
Matt, the nurse that helps us does not have to be Armenian. They could be non-Armenian also. Is that correct?
That's correct. You know, although the home is the Armenian home, many of our patients are not Armenian, and certainly not all of the staff are Armenian. So this is open to anyone. You don't have to be Armenian. In fact, some of our longtime dedicated staff members are not Armenian. So it is open to everybody.
Well, I want to thank you to the Voice of Armenians for helping assist us in helping reach the community so we can find people who may need help, but also to make an announcement that the Armenian Nursing and Rehab Center also needs some assistance during this most difficult time. As many of you hearing this may know, the Armenian Nursing and Rehab Center is located in Bergen County, New Jersey, which is ground zero in New Jersey for the coronavirus problem. It really is an unprecedented crisis that's straining all of the public services that New Jersey has to offer, as well as New York. And many of us have heard the great outpouring of volunteerism in New York. Over 85,000 healthcare providers, these are nurses, these are social workers, psychiatrists, psychologists, health providers of all stripes, have come to New York to assist New York during its crisis. And the same thing is happening in New Jersey, and the Armenian Nursing and Rehab Center is a microcosm of that. They are doing a terrific job at the nursing home. The residents are safe, and thank God they are coronavirus free. But the nursing staff that supports them is fallen ill. And even though they're dedicated and many have been coming to work, they are short-staffed. So we're requesting with this interview that if you should know somebody, whether they're Armenian or not Armenian, and they're involved in the nursing profession, we could really benefit from having them help us and assist taking care of the most vulnerable people, the people we love, and that's our older generation that are now residents at the Armenian Rehab and Nursing Center. So we're hoping, again, should you know anyone, to please call us. Again, the residents are safe. The nursing home is doing well. We're just trying to provide relief for a very dedicated, overworked, and fatigued nursing staff.